Hello, today we are going to talk about the urinary tract infections. Urinary tract infections mean infection anywhere in the urinary tract. It could be the kidneys, the ureters, the bladder, and in men, the prostate. More often than not, urinary tract infection is affecting mainly ladies. And the reason is that they have a very short passage from bladder to exterior, and it is placed in a location which can be easily contaminated from vaginal bacteria and the rectal bacteria. So, as a corollary, if somebody has bad bacteria in the gut, which is not very unusual to find, that means the patient has got constipation or loose motions, then obviously these bacteria can find their way into the bladder in a lady. Especially when the defense mechanisms are low, like lack of estrogen in postmenopausal situation, diabetes, or use of immunosuppressive drugs like corticosteroids, treatment for rheumatoid arthritis, immunosuppression for the organ transplant, or anti-cancer drugs. So it is important that if the gut health is maintained, we can prevent urinary tract infection. It usually presents as burning sensation, a persistent desire to pass urine, frequent desire to pass urine, waking up from sleep, and sometimes the patients are not able to get up from the seat because they feel that something more is left behind in the bladder and is not coming out. That persistent desire is really very bad. There could be pain, there could be some blood at the end of urination or beginning of urination. The most important thing is that you should hydrate yourself well with plain water, or at the most coconut water. You should try to save a sample of urine for urine routine examination and culture, because this becomes important evidence without which we cannot start an antibiotic. Third thing is that if you are so much troubled, and what you can do is you can have baking soda or the soda that is available in the kitchen. So a pinch of baking soda in a glass of water, and if you take that once or twice, it is going to take away your symptoms to a large extent. Make sure that you are not hypertensive or you are suffering from a kidney or a heart disease where fluid is restricted. Then soda is certainly restricted in such patients. Also, if there is no contraindication to the use of painkillers, then you can take a small dose or a single dose of diclofenac or Voveron, which can reduce the inflammation and keep you at ease, but not more than a single dose. Also, you can actually predict in these patients that the infection is going to come, because if they have a loose tummy, then they should be more careful. Every burning sensation is not an infection. It could simply be an infection in the vagina, or it could be something which is like interstitial cystitis, viral urethritis, and it has to be actually diagnosed properly by a urologist. All the best.